Hello, my name is Ashley Davis. I'm a registered nurse and a student at the University of Tennessee. Today I will be discussing with you transformational leadership. There are 4 different leadership styles. The first is autocratic. This is considered an authoritarian, leader makes the decisions type of style. The decisions are made from the top down, and the staff or team members have very little input in the decisions that are made. The next style would be laissez-faire. This is a style where there's really little guidance is given. It's a hands-off approach where really your team members are making most of the decisions. It's sort of a bottom-up approach with leadership. The next is transactional, and this is a system of rewards and punishments. So employees would be rewarded with maybe extra benefits or things like that when things go well, but there would be write-ups and things like that, punishment types if their performance was not as good. And the fourth type, and the type that we're going to be focusing on today, is transformational leadership. And this is the style of leadership that most nursing facilities are going towards. It's a style of motivation, facilitating the employee, empowering them. It's engaging them in the decisions that are made, but still the power is coming from the leader. It's basically used to broaden and elevate the interests of the employees, generate awareness and commitment to the organization or the mission values. Leadership is important. We would like to say that we can just go into work and take care of our patients, but we do need leaders in these situations. They help to focus things as you have focused on patient care. Leadership is also focused on nurse satisfaction and nurse turnover. So when you are able to improve satisfaction and turnover, you're also able to improve patient care. And according to Nursing Solutions Incorporated of 2013, the national RN turnover rate in 2012 was 13.1%, and the average cost per turnover is $36,000 to $48,000. This seems like a really high number, and some of the research that I found was actually quoted this number as even being higher. But what you're looking at here is the cost to recruit a new team member, the cost to train someone when you're double staffed, the cost to pay overtime to someone else when you are understaffed. So it is very expensive, and if we can improve retention, we can improve patient care and lower hospital costs. So the PICO question that I will be studying is for RNs and LPNs working as bedside/staff nurses, how does transformational leadership compared to autocratic leadership affect job satisfaction and retention? So I did a literature review in order to study this question. The first study I did was by Andrews, Richard, Robinson, Solano, and Halloran in 2012. The title of their article was The Influence of Staff Nurse Perception of Leadership Style on Satisfaction of Leadership, a Cross-Sectional Survey of Pediatric Nurses. So what they did was they used a multi-factor leadership questionnaire and demographic study, and they used this to study how nurse leaders and staff nurses perceive leadership. They found that supervisees were more satisfied with a management style that had rewards, so benefits for doing well, and showed that the leaders to be effective, engaged, and putting in extra effort. So they wanted to be congratulated for what they did well, but they also wanted to see a leader who was not just behind a desk, who was also working themselves. And they also found that leaders in administrative roles were seen as using a more transformational style than leaders who were in direct operational roles. So your direct operational roles would be your unit managers and things like that, where your administrative roles would probably be your directors of nursing, your higher-up officials who are not there managing the day-to-day. In the critique of this article, they did use a small sample size, only 16 supervisors and 179 supervisees. It was set only in a pediatric setting, so they're only studying the effects in pediatrics. There was a questionnaire using qualitative research, so you're not really looking at a cause and effect, independent versus dependent variable. And there was a correlation. The correlations between leader and supervisee were not statistically significant. So they did not find it statistically significant that satisfaction was increased by types of leadership. So they did see a trend but they did not see that having a firm transformational leadership style statistically improved the satisfaction and perception of the employees. The next study was done by Ropp in 2008, and the title of this article was The Impact of Emergency Department Nurse Manager Leadership Style on Staff Nurse Turnover and Patient Satisfaction in Academic Healthcare Hospitals. So what he studied was the effect of transformational leadership on nurse turnover and patient satisfaction. Again, he used a multi-factor leadership questionnaire, and he did find that 80% of managers in the study were using transformational leadership. And this is a trend in the United States now that most facilities are going to find transformational leadership as the main type of leadership. And he did find that there was a trend towards lower turnover with your transformational leaders. Their turnover rate was 13% versus non-transformational leaders. They had a 29% turnover rate. In critique of this article, again, a small sample size was used, only 15 managers and 30 staff nurses. There was no trend noted in the difference of patient satisfaction with different leadership styles. The difference in turnover rates was not statistically significant. Yes, there was a trend shown with the styles, the 13 and 29%, but they could not prove a statistical significance. Again, it was a sort of specialized group. Only ER managers were studied, and the only dependent variables measured were turnover and patient satisfaction, where there are other dependent variables that could affect job satisfaction or could be affected by job satisfaction, and these would be things such as work-life balance or work environment, things like that. The third study here was done by Maboko in 2011, and the title of this article was Nursing Leadership in an Academic Hospital in Gauteng. It's a town in South Africa. So a study of nursing leadership styles was done in a hospital in South Africa, and this was based on Maxwell's 4 pillars of leadership, which are relationships, equipping, leadership, and attitude. And they used discussion groups and interviews to collect their data. They used discussion groups with the employees or the staff nurses to find out what they felt about the leadership style of their managers. Then they used interviews to collect the data from the managers to find out what they thought their management style was. And discussion groups revealed that some nurses were using autocratic leadership in this hospital, though the nurse managers during their interview phase did not recognize that they were being autocratic leaders. So there was definitely a disconnect here found in this facility. Again, the critique was a small sample size, 35 nurses, 5 managers. Interviews and discussion groups can decrease the privacy and may decrease the validity of the responses. And noted in the study was that the study was performed 1 month after a healthcare strike of the national healthcare system in South Africa, so that may have decreased the job satisfaction for some of the nurses. And the next article here was done by Clavel, Delaney, Fitzpatrick, and Drendark in 2012. And the title of this article was Transformational Leadership Practices of Chief Nursing Officers in Magnet Organizations. And so in order to obtain magnet status for a hospital, they have to have transformational leadership shown in their facility. So this study used a leadership practices inventory to study leadership styles of chief nursing officers in magnet institutions. It was a descriptive study, and the level of transformational leadership was noted to increase with the age and the educational status of the leader. So any leaders over 60 or who had doctorates were noted to were much more likely to have had a transformational leadership style. In critique of this study, it was only study the upper level management, your chief nursing officers. It was not studying your unit managers, your leaders who are right there on the floor with the staff nurses and patients. It did study how supervisors view themselves. It did not have an employee perspective included. So if the supervisor felt they were transformational, then according to this study they were. No one else was contradicting that information, so there's no comparison group included. But on this study, the sample size was much larger. 384 chief nursing officers were included. The last study here was done by Wong, Shotwin, and Mansapwat. This was done in 2011. This study was the transformational leadership effect on job satisfaction of registered nurses in a hospital in China. And why this article is significant is some of my other studies I found that autocratic leadership is very popular in China still. They really work very much from your doctors are your top and your nurses are your low of the totem pole. It kind of has created the nurses to sort of be unsure of themselves and to work in a very submissive environment, so to speak. So this study studied the relationship between transformational leadership and job satisfaction in China. And they found that the healthcare, so of course, like I said, the healthcare system in China is traditionally autocratic. And they actually did find that it was statistically significant. Positive correlation was shown between transformational leadership and job satisfaction. So this study, you're seeing a change in the leadership in that facility, much more so than you would see in a hospital in the U.S. In critique of this article, it was a moderate sample size, 238, but again, it was a qualitative questionnaire that was used. And so was my PICO question answered? Again, the question was, for RNs and LPNs working as bedside nurses, how does transformational leadership compared to autocratic leadership affect job satisfaction and retention? And I found that this question was difficult to answer with this qualitative research. It's really hard to establish a cause and an effect. The study in China really does sort of show things that maybe there was additional change, but it's hard to find a truly autocratic hospital in the United States and to see whether or not changing the leadership style really changes satisfaction, performance, changes retention rates. So that was a little bit difficult to do without quantitative research. So most of the research was not specific enough. It was a lot of questionnaires and things like that. So it was difficult to find job satisfaction ratings for nurses working under the autocratic management style. And really just job satisfaction ratings and retention rates really varied across the country. It was very hard to find because they would look at very specific groups of nurses, whether they be new graduates or specifically in the emergency department or things like that. So finding the data to really prove or disprove whether or not transformational leadership is effective, I found that the data was difficult to find. And whether or not I can take these research recommendations into my clinical setting, I feel like they can. They can be easily transferred into the clinical situation. Transformational leadership is about empowering. It's about engaging the employees, and I think this is something that can be done in any clinical setting. And it has been proven to be effective through research, but there does need to be more research on this topic. And these are my references. Thank you so much for seeing my PowerPoint today, and if you have any questions, feel free to contact me via email or however. Thank you. Bye.